What if the number you are fighting every morning, the number you are trying so hard to reach, is not actually the number your body needs? For many people over 60, blood pressure control is one of the most important parts of staying healthy. But there is something many people never talk about. Your blood pressure goal is not just about a number on a screen. It is about how your body feels, your balance when you stand up, your energy during the day, your ability to think clearly, and your ability to live independently. I'm Dr. Mandel, and today we are going to talk about something every person over 60 should understand: why the perfect blood pressure number may need to be personalized for your age, your health, and your daily life. Stay with me, because by the end of this video, you will know what questions to ask your doctor and how to recognize when your body may be telling you something important. For many years, one blood pressure number became famous: 120/80. Many people grew up believing this was the only healthy target, and for some people, keeping blood pressure around this level can be beneficial. But the human body is not a machine, and after the age of 60, your body changes. Your arteries become less flexible, and your heart, brain, and kidneys may respond differently than they did when you were younger. This does not mean lower blood pressure is bad. It means the right target depends on the person. A healthy and active 65-year-old who exercises regularly and has no major health problems may have a different ideal target than an 80-year-old who takes multiple medications and sometimes feels dizzy. The mistake many people make is believing that one number works perfectly for everyone. Medicine is not about treating numbers. Medicine is about treating people. Think about your blood vessels like a garden hose. When a hose is new, it is flexible. It expands and adjusts easily when water pressure changes. Over many years, that same hose can become harder and less flexible. Something similar happens inside your arteries as you age. They naturally become stiffer. Because of this, your body may need different adjustments to maintain good blood flow. This is one reason why some older adults notice symptoms when their blood pressure becomes too low for their individual situation. They may feel lightheaded when standing up, more tired than usual, less focused during the day, or less stable while walking. Sometimes people blame these things on just getting older. But your symptoms are information. Your body is always communicating with you. One important thing to understand is orthostatic hypotension. This simply means your blood pressure drops when you move from sitting or lying down to standing. You may have experienced it. You get up quickly from bed, suddenly you feel a wave of dizziness. Your vision changes for a moment, you need to hold on to something. For older adults, this matters because maintaining balance becomes extremely important. A fall can affect independence and confidence. That is why doctors often consider not only your blood pressure reading, but also how you feel, your medications, your medical history, your risk of falls, and your overall health. So, if there is no single perfect number for everyone, how do you know what is right for you? The answer is personalization. Doctors usually look at several important factors: your age, your activity level, your medical conditions, the medications you take, and most importantly, how your body responds. Let's look at 3 common situations. You are over 60, active and independent. Maybe you still walk every day, stay physically active, manage daily activities without difficulty, do not experience dizziness when standing, and do not have serious health problems affecting your heart, kidneys, or brain. For people in this situation, many doctors may consider a lower blood pressure goal appropriate because the body is often better able to tolerate it. But even here, the goal is not to chase the lowest possible number. The goal is protection without causing problems. A blood pressure reading is only one piece of the puzzle. You are over 60 and managing several health issues. Many adults in this age group take multiple medications and manage diabetes, kidney problems, heart conditions, or other chronic issues. Some may notice occasional dizziness, weakness, or feeling unsteady. In this situation, lowering blood pressure too aggressively may not always provide extra benefits. Your doctor may decide a slightly higher target is safer depending on your personal health. The important question is not, how low can I make my blood pressure? The better question is, what blood pressure level helps me stay healthy, active, and safe? You are 80 or older. As we get older, protecting independence becomes one of the most important goals. For many people over 80, doctors pay close attention to balance, strength, memory, kidney function, medication side effects, and quality of life. A number that looks excellent on paper may not be the best choice if it causes constant fatigue or dizziness. Your body's response matters. A healthy blood pressure goal is one that helps you live better, not one that only looks good on a chart. Your body often gives signals before a problem becomes serious. Pay attention if you notice dizziness when standing, especially in the morning or after sitting for a long time. Notice if you feel mentally slower or foggy, if you feel unusually fatigued, or if you feel unsteady while walking. Also watch for very low blood pressure readings repeated over time, especially if they come with symptoms. These signs are worth discussing with your healthcare provider. Your medication may need adjustment. Many people think, my blood pressure is lower, so my medication must be working perfectly. But your body changes over time. Weight, activity level, and health conditions change. A medication dose that was appropriate years ago may need review today. Never stop or change medication by yourself. Ask questions. A good doctor does not only look at your blood pressure number, they look at the person behind the number. 3 steps before your next doctor appointment. Step 1. Understand your current situation. Ask yourself how active you are, whether you feel dizzy, if you have balance problems, what medications you take, and what health conditions you have. Step 2. Track more than numbers. For 1 week, write down your blood pressure readings, the time of day, and how you feel, tired, dizzy, or normal. This information can be much more useful than a single clinic reading. Step 3. Ask the right question. Instead of only asking, "Is my blood pressure good?" Try asking, "Based on my age, my health, and how I feel every day, what blood pressure target is best for me?" That opens a better conversation. You are not challenging your doctor, you are helping them understand your complete situation. Remember, your blood pressure reading is not your identity. It is not a score that decides whether you are healthy or unhealthy. It is one piece of information that helps you and your doctor understand what your body needs. After 60, health is not only about preventing disease. It is about maintaining your independence, waking up feeling steady on your feet, having enough energy to enjoy your day, and being able to spend time with family, take walks, travel, and keep doing what gives your life meaning. Do not ignore what your body is telling you. Many older adults are disciplined. They take medications, follow advice, and check their blood pressure regularly. That is excellent. But being a responsible patient also means speaking up when something changes. If you suddenly feel more tired, dizzy when standing, less steady, weaker, or less clear mentally, do not simply accept it as normal aging. Mention it. Ask questions. Your symptoms are valuable information. A message for everyone over 60. Getting older does not mean your health decisions become simpler. In many ways, they become more personalized. The same advice that works for one person may not be the right advice for another. Your neighbor's blood pressure goal may not be your goal. Your friend's medication plan may not be your plan. Your body has its own history, and your care should respect that history. The most important conversation to have with your doctor is simple. Doctor, considering my age, my health conditions, my medications, and how I feel every day, what is the right blood pressure goal for me? That question can open an important conversation. The best treatment plan is not only about adding more years to life, it is about adding more life to those years. Final reminder, if you are taking blood pressure medication, never stop or change your dose without talking with your healthcare professional. Blood pressure treatment saves millions of lives. The goal is not to fear medication. The goal is to make sure your treatment matches your body. The right blood pressure level is the one that helps protect your heart while allowing you to feel strong, stable, and capable in your daily life. If this video helped you understand your blood pressure better, share it with someone over 60 who may benefit. Remember, a healthier future does not begin with chasing a number. It begins with understanding your body. Thank you for watching.